2020, and then by February we were already incorporated. So we were serious about this, and I'm glad that I'm in it with a group of people that my team members are here to stay and focus on changing and making Coy Fish a reality. So since 2020, we've been part of other competitions for semifinalists for 2 different accelerator programs, have now received funding. So now we're working on, of course, funding, gaining more funds to advance our company and develop our app. So it's been starting a company. I mean, it's not the easiest thing in the world. But if you have a passion for it, you have a drive, then you can do it. A lot of the business owners that you see today, it's not because they just, for the sake of it, wanted to be, broke and poor, because you are as a startup company, but this is something that they truly believed in. And for you, if you truly believe in your company, it'll thrive. You just have to keep going, no matter how many obstacles that you face. You just have to keep pushing, and that's what we tell ourselves. It's something that is needed, something that we truly want and desire. So we have to keep pushing no matter what.
Welcome to Public Health Careers. I'm your host, Emory Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Welcome to episode 128. Thank you so much for joining me today. If this is your first time tuning in, be sure to hit that subscribe button so you can stay up to date with the latest content. And if you get some value from this episode of the show, please support the show by leaving a 5-star review. It really helps out with the algorithm and also helps to get the show out to more people. Also share this with a friend who would get some value from it. Greatly appreciate that. Today's guest is doing some really cool work on her health tech startup, Coy Fish, where they're improving patients' ability to choose a provider that suits their needs. So think of them of like a Bumble of healthcare, patient-provider relationships. I had so many questions around her starting this, as you'll see in the episode. And I really loved her story and her insights. She really shows how you mightn't know something in an industry, but you can learn about it, and just leaning into that and showing initiative is a great way to build your skills, and has led her to this amazing organization that you'll hear more about. So if this sounds like something you would enjoy, definitely stick around. Enjoy.
Today, we have an accomplished and innovative global health program leader who's passionate about medicine, global healthcare management, and social entrepreneurship. She has a Bachelor of Science in Nutrition and Dietetics from the University of Nevada, Reno, then got a Master of Public Health at Emory University. She recently finished her master's degree in Physician Assistant Studies at Morehouse School of Medicine. She is the co-founder / co-chair for Women in Global Health Nigeria, as well as she is the CEO and co-founder of Coy Fish. We have Calbeth Chika Alaribe, MPH MS / PA S2. I don't know the S2. We'll get into that later on. Welcome to the show.
Nice to meet you. Thank you so much.
Yeah, it's my pleasure. And I know it's a little awkward sometimes when I say the syllables in people's like degrees, but I don't know. I think it's fun. Yeah. So I guess we could hop right into it. So how do you identify, and then tell us a little bit about your personal background?
Okay. Identify as she, her. So originally I'm from Reno, Nevada, first generation born Nigerian American. For a while now, I've just been trying to find ways to broaden my box when it comes to creativity and my purpose and my calling in this life. I think growing up as a Nigerian American and traveling to Nigeria several occasions, I knew I wanted to do more for our society in terms of helping people. So that kind of fostered my knowledge base, or my curiosity to learn more about public health. And it brought me to Emory University, fortunately, which even made me more curious about health, global health in general, and then also medicine.
Awesome. Well, we look forward to hearing how all that unfolds, and there are like a lot of cool different narratives that come out of your story, like public health and global health, that I'm very excited to hear more about and hear like how you got into this kind of stuff.
Hey y'all, you may be looking for ways to show support for public health, health equity, and this platform, the Public Health Millennial. Well, head over to my shop at thephmillennial.com/shop to buy and support if this show has helped you. Also, use the code podcast for 20% off your next order. Link is in the description to the shop. Be sure to tag me on Instagram at thephmillennial. Thank you. I look forward to sharing your pick. Now back to the show. Yo, are you looking for an online community to connect with like-minded health-focused people? Join my free community health and wellness Discord server at thephmillennial.com/join. You'll find growth-focused people talking about important community and personal health topics, networking opportunities, online yoga, book clubs, and more. Be sure to introduce yourself when you join. Link is in the description. Now really, back to the show.
And before we get into all of that, what does public health mean to you?
That's a good question. Public health is it's very generalized. Public health means the protection of others. Public health means you're very selfless. You're focused on the well-being of other people. You're focused on what you can do to advance society and make sure that everyone in society has a fighting chance. And that for me means health. Everyone should have equality when it comes to health. And if there's others that don't have the resources to have good health, then we as society need to come together to make sure that they have the resources necessary to have equal health. So that's what public health means to me.
Okay, I appreciate that. And I'm excited to hear like more about your, because I feel like I don't hear many people growing up in Nevada or Reno, Nevada. I haven't met many people growing up in Reno, Nevada. So like before we jump into more of like your collegiate story, what was that experience like for you? Did you say you were born in the US or did you immigrate across?
I was born in the US, and I was born in Reno, Nevada. And Reno is such a small town, maybe 8 hours drive from Las Vegas, Nevada. So when people hear Nevada, they think Las Vegas. But it's such a small town. In terms of diversity and population, it's very, very limited. So most of the time growing up in most of my classes, I was the only Black person. And it was very difficult to kind of associate myself with other people. And then also growing up, if you see a lot of the healthcare providers, you're not going to see a minority healthcare provider. So that was very difficult to see. So I knew that I wanted to be different and change that type of landscape of seeing other people that look just like me in healthcare. And I think it even increased going through struggles with my mom's health. My mom, Nigerian woman, came to US, was struggling for the longest time with her battle with sarcoidosis, which it's a respiratory disease that usually affects, or actually not more so autoimmune disease that usually affects African American women. And I saw her battle with it, and coming from Nigeria, where most of the time her focus is on finding herbal remedies to diseases, and knowing that wouldn't help her ultimate outcome, and then also struggling to communicate her needs to her healthcare providers that don't look like her. Seeing that struggle, I knew I wanted a change. She passed away in 2019, and that really, really invigorated my mindset when it came to healthcare. I knew I definitely wanted to be a part of dismantling that idea that people that look like me don't necessarily have a right to be a part of healthcare, because they do. And I wanted to kind of change that narrative.
Yeah, well, I condolences on the passing of your mom, first of all. But I'm glad that, yeah, you're most welcome. I'm glad that you are doing the work that you are doing to kind of like not only say, okay, let me take this pain and the understanding of what it was like for your experience and try to funnel that into a better world for other people so that they don't have to experience that. I think that's awesome, and I'm looking forward to hear more about that. So you got your Bachelor's of Science in Nutrition and Dietetics with a minor in Human Development and Family Studies at University of Nevada, Reno. What was the thought process going into this degree?
I don't know, honestly. I knew I liked nutrition. Originally I was in nursing school, and I didn't felt like that was necessarily for me. But nutrition, it was more so how could I learn more about nutrition and like make an impact that way with, encouraging people to eat healthier and have live healthier lifestyles. So that was my thought process. And when I got accepted to Emory University, I thought I was going to do my master's in global health, focus on nutrition. But when I got there, completely changed my mindset. So Emory University, you have the opportunity to take, like, let's say someone takes 9 credits and then someone takes 15 credits. You're paying the same tuition rate. So I used that idea to basically take more classes and broaden my horizon in so many different things. And Emory honestly gave me the opportunity to learn more, not about nutrition, not about just global health, but everything else and that comes to healthcare, whether it's business and healthcare, law, management. And I think you had a minimum requirement of taking 42 credits to graduate with your master's in public health. I ended up taking 72. And I learned so much about business and healthcare, law, policy, how to manage healthcare systems. So it gave me the opportunity to kind of broaden my horizon and learn more about the healthcare system in general, which kind of honestly helped me with everything else I'm doing today.
That's really cool. And I haven't heard many people speak about that. Is that like block tuition where you pay like a certain block and then you just take as many classes you can up to a certain credit limit?
Yeah.
Okay, and how do you find out about that? Or is that just like something that's Emory that you can do at Emory?
I think that's honestly for every student you can do that. So I didn't know that until I started classes there, because I was really curious about. I was talking to my advisor, and I was really curious about taking certain classes, and she was telling me why not. And I told her, am I allowed to? And she's like, you can take any class that you want here. So I honestly took that as an opportunity to learn more about other things, and I'm glad that I did.
Yeah, that's great, because I can imagine, because typically it is 48 credit hours and you said it's 72. I don't know what percentage increase, but that's a lot more classes. So the amount of like just the amount of just like knowledge or like just coursework and things that you probably gain that other people mightn't have gained or mightn't have gotten the opportunity to learn or just talk more about or think more about. So that is definitely something that is something that insightful that other people could use as well. But was that more stressful?
Honestly, I had the most fun. Even with everything I was doing in classes, I was traveling. I still had a life. People that, I mean, some of my friends till this day do not know that I took that many classes, because I was always, still living life. But I'm glad I did, because it definitely helped create a stepping stone for me for the next part of my life and my career.
Yeah, absolutely. And just to take us back a little bit, so during your undergrad, you said nursing, then got into nutrition dietetics. When did you learn about public health?
I remember I was like in a standstill after I graduated with nutrition. I just didn't know what I wanted to do after that. And so I just remembered curiously just learning more about volunteering in different sectors, and, the community, especially Northern Nevada, and seeing if I could be a health educator. So I came across an organization that was wanted to hire people to do health education, nutrition education for people of low socioeconomic status. So I did that. I became more curious about learning about other places to volunteer at. And I started learning more about the community that I was working with. And I was really interested to know, okay, could this be an actual career, like really helping people within the community that you not only live in, but potentially could serve in the future. So I learned more about community health, and that kind of invigorated my curiosity towards community health, public health in general. And then I also love to travel. So I wanted to learn more about globally, like the health of other people around the world. And so I decided to pursue global health at Emory and ended up getting accepted.
Yeah, Okay, that makes a lot of sense, and that's awesome that you're able to find the path to get to public health and get to Emory. And I can imagine the change in like from going from Reno to Atlanta is probably a big change. Do you know?
It was
Do,
different.
yeah, tell me how that transition went for you.
I think I remember like when I got accepted, I think maybe 2 or 3 months prior to me going or getting, starting the program, I went with my mom to look for apartments. And I could just remember we were taking an Uber and she was shocked because I mean, I'm black. I didn't know that there are so many other black people. The culture shock because the only time that I've seen that many black people in one setting or minorities in general was when I went to Nigeria. So I kind of felt at home, but it was so different from Reno, Nevada, where I don't typically see that in a regular basis. So it was welcoming, but also culture shock for me, which is surprising.
Yeah, that's amazing, and I can imagine how that also like just broadened your perspectives on life and what is out there and different things like that as well. What,
Exactly.
yeah. So, were there any other takeaways from your MPH program that you wanted to share outside of like maxing out credits, doing all the things it seemed like you did?
Honestly, I would say that if you're curious about something, pursue it. I remember I was curious about ethics, global health ethics, and I took an ethics class, and I'm glad I took it because it led me to the next part of my life, working in global health. I remember reading an article in my class about women in global health and how they, are trying to shape policy to advance women leadership in healthcare. And I was really curious. So I saw their email or contact information, and I ended up emailing them and looking for opportunities after graduation. And I'm thankful that I did that because at the time they just started their organization. And I was looking for, any volunteer opportunities available. So I ended up getting an opportunity after graduation as a chapter development personnel focused on like advancing the chapters in different countries. And that led me from that to then becoming leading in it. And I worked there for about 2 years. I traveled. I met the World Health Organization general director. I met the former president of Liberia. I had a meeting with her. I did not know that I would be able to do that. And so I would say that if you're curious about something, continuously pursue it, and you never know what's going to happen with that pursuit.
That's amazing, and I can imagine how like going from the internship and then getting to do this lead role and then getting to travel. Tell us a little bit more about the work that you had to do in creating these chapters globally, and like where globally did you work, and what was the logistics of your job? Like, were you in the US most of the time and have to travel 50% of the time, or tell us more about that.
So originally, when I first started, I was in the U.S. and I was focused on starting chapters here in the U.S. But I was also curious about learning more about how to start chapters in different countries. So I spoke to the executive director at the time, she's still the executive director, Dr. Rupa Dot. And I told her that I was really curious about learning more and working, outside of the U.S. So she gave me the opportunity to then travel. So if there's any traveling opportunities I did to learn more about, women World Health Organization stakeholders, health ministry stakeholders. I would have meetings with them. I was talking with them, Zoom calls, learning more about different countries and what they're looking for in terms of equity for women. So that kind of helped. And then it went from working and developing chapters in the US, then working on developing chapters not only in Africa, but in Europe and Asia. And so working with these women just really empowered me because a lot of women out, and especially not in just the US, but globally, are really working to advance healthcare. But they're unrepresented because you see a lot of women, but they're in terms of in superior positions and leadership positions is very limited. So seeing these women trying to change that dynamic was very empowering to me. And by the time I ended up leaving, I think we had opened nearly 20 different chapters globally. I think more than 4 or 5 chapters in Africa. And then I also decided to start a chapter in Nigeria. So that led to Women in Global Health Nigeria.
That's truly fantastic work that you're able to do, and that's just a lot of breadth of work and being able to experience all of that. Like I could only imagine coming from like your perspective of knowing that your family came from Nigeria, and then going to Reno and living in Reno, I should say, and growing up there to go into Atlanta to being able to work in the US and then around the world doing this important work. Were there any like themes that stood out across countries, across regions for equity for women?
Yes, I think the biggest thing is just how could we get a seat at the table? Because women, approximately 75% of women are in the global health workforce, but less than 10 or 25 or percent. I'm trying to approximate numbers, but don't quote me. Are not in leadership positions, and these leadership positions are held by men, and men are the ones that are making decisions for women. So that's a problem that we still face globally, and it's very challenging to women, especially for, now you're seeing, especially in the US, and not just the US, globally, but reproductive rights for women, and their needs are not being met because of these people making the decisions for them. So that's one thing that is still a challenge, but women are not giving up. That's another theme that I'm seeing, that women are not giving up. They're taking their stance. They're doing whatever they can to provide equity for all women around the world.
Yeah, that is too true. Too many organizations that are serving women, men, they have men in leadership when they have many competent women that can do the same job and understand the implications of it just a little more seriously than the men that are there. So that is quite interesting. But thank you for sharing. And you also do healthcare public speaking. So how'd you get into that type of public speaking work?
By chance. I honestly didn't even know that this would be another part of my life. I don't know. I would come across different opportunities, or people would lead me to different opportunities to share my experiences, and then it went from that to then people formally asking me to do public health speaking, and then from that being paid to speak. So it kind of naturally grew. And a lot of people don't know that I'm introverted, so even speaking is a very difficult thing for me to do. But I enjoy speaking about my experiences and hopefully sharing my experiences with other people, and learning from other people as I speak on different panels. So and honestly, everything comes by, I think, for me, destiny, and if it's destined to be. So if public health speaking or speaking in general is something that you want to do in the future, work towards it, hone in on your skills, and you never know who you're going to come across that'll help lead the way for you to do that.
In you saying that, what are the skills that they should hone in onto?
Honestly, honing in on being authentic with yourself. Don't try to, I think one thing we try to do as people is try to, I guess you say, fake it till you make it, which is true, but that's not for me. I'm honestly, speaking makes me nervous. And even I've spoken on so many different panels, but I still get nervous. So I try to truly prove and tell people that I'm nervous. Even on speaking in panels, I do say that, and I try to be myself. I don't try to misconstrue words. I don't try to share experiences that I've never ever experienced. I am very true to my word. I'm true to what I say. And if there's things I don't know, I will say that I don't know because I've never experienced it. So I would definitely say hone in on that. And then practice speaking to your family members, your friends. I've done that, and just work towards that.
Yeah, great insights there. And you also recently completed your Master's of Science in PA Studies at Morehouse School of Medicine. So what was the thought process? Well, first of all, congratulations.
Thank you.
You're welcome. What was the thought process for you wanting to pursue this degree? Because you said that you're doing this you're doing this global health work where you're getting to go all over the world and make these chapters, and then you transition. I'm guessing you also did like the public health speaking, healthcare speaking while you were doing this. What was the thought process of going and getting the Masters of Science?
I've always wanted to practice medicine. That's since I was little. I thought I was going to be go into medical or the MD route. Since I was 5, I've always wanted to be go into medicine. So my route to medicine has changed. It changed. It didn't change drastically. I think I finally realized the type of medicine I wanted to practice, and that was as being a PA. So even when I was applying for my master's in public health, I was also applying for PA schools, like schools that did dual degrees, master's in public health, and then master's in to become a PA. So I unfortunately didn't get accepted to a dual degree program at Emory, but I'm thankful for it because it gave me the opportunity after graduation to travel and do all the other things I did with Women in Global Health and other stuff I was working on, and then eventually get accepted to Morehouse School of Medicine. So I'm thankful for that journey. And I'm thankful, honestly, it's perfect timing because it was exactly what I need to do at that time. So yeah, I ended up graduating, still working on finding my niche. I know that I want to work in women's health, OB-GYN, hospital medicine. So seeing where that leads me to, in finding a job opportunity for that.
Well, I'm glad that you highlighted that, because I'm guessing at that time when you were applying for those MPH slash Masters for Physician Assistant School, and you didn't get into that program at Emory specifically, you weren't the happiest. But looking back on it now, you were able to experience something that you would not have been able to, which has made your experience more fruitful or just like more wholesome, and giving you more perspective and like what you are able to do. So just saying that for anyone out there that might be facing something that might be a struggle, there's just a redirection in your path and you don't know what else is in store for you because of that opportunity not coming through or whatever that case might be.
Yes, I would thank you for saying that because that's very important. At that time, I was so upset and I didn't think I would eventually become a PA, but I'm a believer in God. And one thing I know is that God's timing for me personally is the best. And that was the best thing for me because Morehouse School of Medicine, I was around people, especially my faculty members that looked like me. And that was encouraging to see that because I've never seen that, and also now it's shaped my ideas on how I want to practice medicine. I'm not only want to practice medicine, I want to improve health equity in the US and globally, of course, but I want to hone in on what's going on in the US because not only am I a Nigerian American, I was born in the US and there's so many problems in the US. And I know that as a practicing clinician, I want to help change that problem. So it's really emphasized my need for and my desire to practice medicine with the health equity focus. So I'm glad that it changed. I'm glad, honestly, in general, that I went to Morehouse School of Medicine, and that's exactly where I need to be.
That's great to hear, and thank you for sharing that. So was there any particular reason that you wanted to go the physician assistant route and not like an MD or DO route?
Just I think for me, the type of I guess balance I wanted to have. One thing I've known for myself is I love medicine. I've always been passionate about medicine, but medicine's not my life. And not to say that MDs or DOs are solely focused on, just practicing medicine, but I knew the type of medicine I wanted to practice. I knew that eventually I could see myself practicing, women's health one day, and then maybe down the line, if I'm not interested in that, practicing or doing another specialty. So that was for me. I have a lot of friends that are MDs. I have friends that are DOs as well. But I knew for me personally that PA route was the best for me.
Yeah, that makes a lot of sense. And I think that's great perspective. That is one of the reasons that I also decided not to pursue medicine, because I thought in the perspective of I'm going to go to school for so much more years to get so much more debt to take these exams that are going to stress out my life. And I feel like I wouldn't want to be a physician for the rest of my life. I would want to do something else. So I just thought there's something else. And public health was that something else. So I'm happy. I'm happy like for you, and that's awesome. So outside of like being around people, professors, teachers that were Black and were like yourself throughout your time at Morehouse School of Medicine, are there any other takeaways that you had during that time?
I think the biggest takeaway was the school that so I was very particular with the school that I wanted to go to next for PA school. I knew I wanted to go to a school that had a mission, and that was a mission that was focused on health equity alone, especially for underserved populations. And Morehouse School of Medicine, I mean, they're known for that. I knew I wanted to go to a school that might not be the, in the Ivy Leagues, or school that isn't well known. I mean, in like Emory, but a school that gives me what I needed. And with all the work that they're doing, I mean, Morehouse School of Medicine in general, every I think during the time I was there, like every month they're raising funds and gaining funds for health equity work. So I was glad to be a part of that, and be a part of a school that's actually being recognized around the U.S. for their focus on health equity.
Yeah, that is awesome. And yeah, I have toyed with the idea of looking into going to Morehouse or another HBCU just to like get some of that experience. But I haven't gone very far down that path. But I've heard the experience is very rewarding.
It is.
Awesome. And then so you graduated. I think you graduated when you became the co-owner, vice president of healthcare operations at Beta Homecare Services LLC. Is that correct?
Yeah, so that was after I graduated. So Battelle Home Care Services has been around for decades. My parents were the ones that started that company. So I grew up in healthcare. It's a company focused. It's in Northern Nevada, focused on providing care services for people with limited disabilities. So seeing my parents start that company up was amazing. And then when my mom had passed, I took over alongside my dad and my siblings as well, to help continue the company. So that's been around for a while. So that honestly helped my skill sets when it comes to healthcare management, and eventually starting my own health tech startup. So yeah, that's how Battelle started.
Oh, that's amazing, and I didn't know that I didn't know that your parents started this company, that you were able to come in, and it feels like doing your MPH, getting your MS degree and physician assistant probably helped the skill sets a lot to come in and support the work. Did any of your family have a healthcare background, or is this something that you just built up kind of?
No, yeah, my dad, social worker, dad has like more than 2 masters. So he's business focused. He has a master's MBA, he has a social work background. So, and then my mom as well, she was working for the state of Nevada, in terms of working with people with mental health issues for years. So health is a big proponent in each of our lives. So it honestly, health is it's second nature to me when it comes to health beings and serving others. So my parents definitely honed in on that with us and encouraging us to look into, how ways that we can serve people, and work with people, to better the health of other people.
Yeah, that's awesome, and definitely just seems like natural for you to fit into that. So what were the healthcare management things that were difficult for you to learn, or it was just like not as natural coming into this role?
It was natural to work with people. And I think after my mom passed, being in that management level, like I was managing 40 plus employees, learning just on the ground running, working on managing people. How do we advance the company in general? How do we infuse innovative technology to make, run the company smoothly? How do we deal with conflict? A lot of that was I didn't study that. I didn't, I took business classes here and there, but it was still something that I just never had practical skills learning in terms of learning. So I kind of had to learn on my own. So I say that to say that you don't have to go to school for everything. Honestly, there's certain things that you're gonna learn on the ground. I'm glad that it helped me because it literally helped me learn how to run a company and where to start from. I'm glad that I had the opportunity to do that.
Yeah, absolutely. If you imagine managing 40 people, that definitely is a lot, I'm guessing, because not only does that come that management, but there's all the other like strategy and things that you have to think about. So I can only imagine. Um, what were like your main roles in this position?
I was responsible for healthcare operations, so how the company ran. Also, the managers of each of the home care or homes, because it's a group home care company, would report to me. Finding innovative technology to run systems smoothly, that was my responsibility. Making sure the company was working and functioning was basically my day-to-day activities. So yeah, that's pretty much what I did.
Okay, awesome. And going along with the theme of your story and like global health, women's health, you are an advisory board member for the Women in Global Health Georgia. How did you get this, and like what do you support with as an advisory board member?
Yeah, so I was an advisory board member for about a year. That was from I believe 2021 to 2000, this ending of this year or beginning of this year, I stopped. But because I was in Women in Global Health already, and I was also co-founder of Women in Global Health Nigeria. The Georgia chapter, the US state Georgia chapter, was created, and they decided to have me come on board to help with learning how to start a chapter, since I had already experienced developing a chapter with Women in Global Health Nigeria. So my main focus was just kind of advising them how to start a chapter, um, um, some of the resources they may need to start a chapter, partnerships, things like that.
Okay. And I don't think I asked specifically earlier in the global health role that you had. What is a chapter when it started? What exactly is the role of a chapter?
A role of chapter is to work on I guess, partnering with their governments to find and develop policies that will shape the dynamic of healthcare. Like, for example, how can we change the ideas of the current system that will give women the opportunity to be in specific leadership roles in the health workforce. So that's the role of a chapter, working to shape and change policies in their respective countries. Um, yeah.
So it's like a network of professionals that are working towards like advocacy change.
Yes.
Okay.
Mm-hmm.
Okay, that's really awesome. And what are some of the key things like in developing a chapter? Like it doesn't have to be very specific, but I feel like it'd be helpful to know how to build out some sort of organization that does network building of to relate to advocacy and policy change.
Yeah, a lot of biggest things you need, of course, members. So how do we get members? How do we recruit members? And how do you recruit members that are going to be part of the leadership board? How are you going to recruit members that are going to be part of marketing, part of research, because you need research to learn more about policies. So that's one of the biggest things or first steps. And then the next step is, how do you develop partnerships with institutions, private sectors within your country that will help, with the development of these new policies or policies that you want to implement? Or what are the partnerships that can lead you to working with the government? So those are the things that you definitely need to hone in on and talk to people in order to help you do that. And then another thing is, how do you fund your chapter? Because you need money. So how do you fund your chapter? How do you work to raise money for your chapter to maintain and secure your chapter and maintain the stability of your chapter over time? So let's say you have policies that say that you're going to be running a chapter for 1 year. After that, how do you ensure that the chapter is going to be maintained and running in the next 10 years? So those are things that you need to look into if you're going to start developing chapters.
Okay, well, thank you for sharing that. Definitely helpful. And now this is like interesting because we're going to get into more of like your business and your social entrepreneurship side. So in 2020, you were part of an MIT Hacking Racism in Healthcare, and you were the winner and part of this team. So tell us more about this experience and what it took to win, because in public health in general, I feel like we don't talk about hackathons and things like that. So that I think this is fascinating, and I was very intrigued to see it on your LinkedIn profile. So share more about it, please, and thank you.
Yes. So while I was in school at Morehouse School of Medicine, I came across a hackathon, MIT's hackathon. It was their inaugural hackathon focused on finding ideas that will dismantle racism in healthcare. Since at that time, that was during COVID times, and everyone was seeing blatantly how COVID was affecting minority populations in terms of health outcomes. So I think the hackathon was 72 hours. It started on a Friday, ended on a Sunday. So me and another friend at the time, we decided to jump on board this hackathon. And it was crazy because I was still in school, so I had homework, I had assignments, but this was so important to me, and honestly, it was just something I could do that was kind of different. So I decided to participate, and we had a team that we came across, and for 72 hours, we're just kind of finding unique, innovative ways, trying to think through ways that we could come up with an idea. So we came up with an idea about an app, and for 72 hours, kind of honed in on what the app could look like potentially, and how we would pitch it, because by Sunday morning, you had to pitch your idea. So we ended up pitching the idea about how we could change patient-provider relationships, and then ultimately, there's several different focuses. We're in the public health focus, and we ended up winning. So it was I don't even know, honestly. We were very shocked, but I think we're 19, or the first out of 20 teams. There's 20 teams in total. So we won with other additional 19 teams out of several other teams from not only the US, but these are people that are participating from around the world. So it was very exciting to be a part of that process. And then after that, I was still interested in just trying to create an app. So it was me and another of my other friends. We decided to kind of use this as an idea to venture off into developing a specific app meant for patient-provider relationships, and actually work towards tweaking and advancing what the app would look like. And now today it's an actual company. So we were fortunate to be a part of that process.
Yeah, that truly is fascinating, and it definitely does set you apart from many other people in the field. And I want to like dig a little bit more into this hackathon. So who consists of a team? Are the team do you have to like be a student to be part of this hackathon?
You don't have to be a student. You could be healthcare. You could be a professional in any degree. Anybody that has skill sets in anything at that point could participate in. So you didn't have to be a student. There's people, even high school kids, that were participating. So yeah, honestly, people that have been in their industry for 20 plus years are also participating. So you didn't have to be a student for this.
Okay, and how many people were on your team, and what was that process for like finding a team? Did you like actually just know that someone had a team and you reached out to them, or what was that? How did that
Yeah, so let's say you come up with an idea, or you have some type of idea, and then you can ask people if they want to be part of your team. So I think in total we had maybe five. There was a team of five. We were a team of five. Yeah.
And how did someone have to decide on like the idea of what they were doing? Like, is it like case studies, how you would get a case, and then in that 72 hours you have to solve the case and present on it? So is it very similar in that you choose your team, you know that broadly it's going to be around this, and then when your team submits or like gets into the competition, you get the prompt or whatever, and then you move forward from there?
Yes, so I think the emphasis was the broader scope of the hackathon was how you dismantle racism in healthcare, and the public health focus was how would you do that from a public health standpoint. So that was just very general. That was a question, and within 72 hours you have to come up with an idea.
Okay, awesome. And what do you think are the things that really helped you all to, as a team, to develop a product in 72 hours that was able to win this competition that had people entering from many, many different places, and I'm guessing was very competitive?
Yeah, I think just honing, like I keep emphasizing honing in on your skills, like what do you bring to the table that might be useful to help with this process. So of course I have a public health background, and then a friend that was also part of the team that we joined together had a public health background, and then we met an MD, and then someone that was working in ethics, and then someone who was working in engineering. So we kind of worked together to kind of come up with an idea.
Okay, and last question about this. How much of an end product did you have to present in that last presentation?
You just kind of had to have an idea of what it could potentially be. You didn't necessarily have to have everything to put together, but I think they're more focused on what your idea could actually, how it could actually formulate and be something of use in the future. So I think that was the reason why we won.
Okay, that's really awesome. And like congratulations to you, like, and kudos to you as well for taking time, like 72 hours out of your day when you're still a student, still doing all these things, to say, hey, let me join this and do something that I don't hear many people in public health talk about. I would definitely would have loved to do something very similar to that. I think it's always interesting when you have like a issue at hand and then you have to go in and solve it, and they give you a certain amount of time. It's a little stressful.
Yeah.
Yeah. Oh, I remember my question. Did you have to use a lot of data and stuff to back the product that you were making, or was it more just conceptual?
Yeah, data. Definitely have to look at data. 'Cause at the pitch on that Sunday, they would ask questions like, well, why, or have you come across this? So you kind of have to look at your information to back up your idea.
Okay.
Yeah.
And how long was the pitch?
I think it was like 5 minutes or something like that, or less than that, maybe. Yeah, it was very brief.
Wow. Okay. That is very brief and a lot of
Yeah.
work, I feel like, for 72 hours to be so
Yeah.
brief and concise. So you really have to hit on your points really well.
Yeah.
Okay, well, congratulations to you.
Thank you.
Yeah. And okay, so then that idea, you said you took it with a friend and you decided to create a company, and that company is called Coy Fish, not spelled like the actual koi fish, but COY Fish. And you are the CEO and co-founder of that. So tell me more about that process, going from this hackathon or hacking racism in healthcare and winning that to creating this company.
Yeah, so Co-fish started, of course, from that hackathon, but then it was okay, we had an idea, but we needed to kind of really dive deep and see if this would actually work. And then actually we changed a lot of the concepts that we did have at the hackathon was actually changed because we actually did even more in-depth research to see if it would actually work. So now it's kind of, I would say, very different from the actual idea originally. We've expanded a lot more now to emphasize a lot of the developing the personable relationship between the patient and the provider, especially for the new age generation. I mean, they're very tech savvy, social media focused. So how do we get their minds to think of health as not just important but fun? Health is always seen as mundane, depressing, and we wanted to make healthcare more innovative, unique, fun for people to, be curious about their health, changing their health. So we wanted to kind of be more so the social medias of healthcare. How do we get the younger generations learning about their health, changing how they think of health, and making health more of something to look forward to learning more about.
Okay, so kind of like the TikTok for healthcare.
TikTok to healthcare, and think of it like the Bumble of healthcare. Like how do we make providers, because we've always been taught that our providers are the ones that choose us as patients, but that should not be it. I mean, patients should be able to choose the type of provider that they want, someone that resonates with them, somebody that makes sense to them. Me as a Black woman, most of the time I'm actually looking for a Black woman or provider, or somebody that's going to understand me a lot better, or somebody that maybe we have the same background. So why is it always the fact that providers should choose us? Patients should choose for their providers, and that's what we're trying to change.
Yeah, I love that. I love that. And in 2022, that is definitely how it should be, because we already understand all the implicit biases and all the other things. And just feeling comfortable and respected by someone, I think, is something that healthcare can give us in the US. If we already pay 20% of our GDP to it, like, why not make it equitable in the sense that people get the providers that they want?
Exactly. I mean, you can choose here, especially now, there's Netflix, you can choose the type of movies you want. So why can't we do that with our healthcare?
Yeah, absolutely. I feel like healthcare and public health in general, like, is very slow to a lot of those types of changes, while we have TikTok and whatever other new apps are coming out. But I'm happy, like, you are out there doing this kind of work, because it really is awesome. And the question, like, how quickly did you go from, so when was the hackathon in 2020 to actually creating the organization?
So Hackathon was October of 2020, and then by February we were already incorporated. So we were serious about this, and I'm glad that I'm in it with a group of people that my team members are here to stay and focused on changing and making Coy Fish a reality. So since 2020, we've been part of other competitions for semifinalists for 2 different accelerator programs, have now received funding. So now we're working on, of course, gaining more funds to advance our company and develop our app. So it's been starting a company. I mean, it's not the easiest thing in the world. But if you have a passion for it, you have a drive, then you can do it. A lot of the business owners that you see today, it's not because they just, for the sake of it, wanted to be, broke and poor, because you are as a startup company, but this is something that they truly believed in. And for you, if you truly believe in your company, it'll thrive. You just have to keep going, no matter how many obstacles that you face. You just have to keep pushing, and that's what we tell ourselves. It's something that is needed, something that we truly want and desire. So we have to keep pushing no matter what.
Yeah, and it's awesome. Like, your story kind of comes full circle, because you said, like, when you were in Reno and living there, you didn't get representation from providers, and you saw how that, like, affected not only yourself but your family. And now you're creating a solution to better address the needs of people like yourself. So like, kudos to you. I just wanted to highlight that as well.
Thank you.
Okay. I'm very interested here, so I got a few more questions, and things are just keeping popping up as we get going. So, your co-founder, was the co-founder the same person that you went to the hackathon with? And if it was, or if it was not, tell me, how did you get a co-founder, and tell me more about how you build out a team.
Yeah, so the co-founder I have today is not the same person from the hackathon. My co-founder today is my best friend that I've known since I was little. So we've always strived to, like, grow and develop our skill sets in so many different things. And I think for the longest time, we've always wanted to do something together, but just didn't know how to. So this opportunity came forth, and since then, we've literally been working day in, day out. I mean, she is an amazing person as well. She's, in healthcare spaces, the healthcare space as well. She's a program manager for a pharmaceutical company. So even in her day-to-day activities doing that, and having a family on top of that, she's also building a company with me. So it's me and her, and then our other amazing team members who are healthcare providers. We have an MD, we have another PA on our team, and then an engineer too. That we practically all have known each other. Majority of them have known each other through me. So the team is amazing, and they're not stopping. They're really continuing on building up our company.
Yeah, that truly is amazing, and that's awesome that you get to work with your best friend
Yeah.
from being young. Tell me more about being in these accelerator programs and what that has meant for you and as well as the company.
Um, it's meant a lot because it's pushed us to learn more about our weaknesses, not just as a company, but our weaknesses in general as people. It's really taught us a lot about teamwork, and you can't have a dream without a team. And so you need people that are going to continuously not just contribute, but people are going to push you. I mean, yes, I'm CEO, but my team members push me. They question some of the things I say, and I'm glad that they do because we need that in society to grow. So it definitely shows you that your true character and shows you your weaknesses and what you need to hone in on working to improve yourself as a person.
Yeah, that's amazing. I think that the best people to have around you are the people that challenge you to think more about the things that you are just naturally thinking about, because as you said, that's how you grow, because we
Mhm.
can get in a fixed mindset in a lot of ways. Um, okay, you also spoke about getting funding. What was that process like for looking for funding to get funding?
It's very strenuous. It's a lot of work. Because you have to, in order to get funded, people have to truly believe that your company is gonna work. And so, pitching and then pitching and failing. I mean, we've pitched several times and have failed, and just working to get better. So I'm glad that the process has taught us a lot about ourselves, and what we need to work on. But it's a strenuous thing. But like I say, you can have 100 rejections, but that one yes is an amazing feeling because it makes you know, or makes you think and believe that actually there's someone out there that truly believes in you. So I say that to say that your 100 rejections does not necessarily mean that you are doomed for failure or your dreams will never come true, because it will. I mean, how many other companies existed? Amazon. I mean, how many rejections did they get before they became big? So just never give up on your dreams.
Love it, love it. And are you currently in the stage of do you all have a functioning working product? And then if you do, how do you push that out to providers for people to actually use it?
Yeah, so we're still working on our product right now to get it released. Hopefully, we're working by next year to be released. So we're working on doing that. But in terms of getting providers on our platform, I mean, it's second nature to us because a lot of us are healthcare providers that have connections to other healthcare providers. So that's not a problem. The thing is just getting it across to your customers. So it needs a lot of marketing skills. We had a marketing consultant, so it's getting that across. But because we're social media focused, we're of course going to use social media. That's kind of what we're working on. How do we market and target our customers to see our product and be interested in learning more about a product and potentially utilizing it?
Yeah, that truly is awesome. And I look forward to seeing how that all unfolds. Another question, well, I think I have two more questions about this. so, so I see a lot because now I talk to more people just generally in life with people in like the health tech space or like just the tech space. And I know that people generally in public health don't think about themselves as like user experience experts or things like that, but I think we have a interesting perspective and like understanding like what the community needs and a skill set in building out those things. So how are you thinking about user experience and UX and UI for this app as it's being developed, being pushed out?
Yeah, so user experience needs to be user friendly. So that's why when you're developing an app or developing anything in general that is customer user focused, you have to develop something that is easy for them to use, that's uh, creative, unique, fun, visual. Like a lot of people love visual things, so it's a lot of testing and stuff like that. So that's why you first start off with a prototype. you get your prototype across to different customers to see what they're into, if they like it, if things are needing to change, and then use that to then advance the prototype, make it unique, different from what it originally was. So there's a lot of user testing, and it's important that you do that so that you know for sure that your users will use it. So definitely test.
Okay, I appreciate that. And yeah, that does make a lot of sense. To just get like feedback from the community that is going to use it. That makes sense. Okay. So in building out this health tech company that you're doing, what advice would you give to people that are like in public health or studying public health if they wanted to build a similar type of company? What advice would you give to them?
Just do it. Just do it. I mean, there's gonna be people that are gonna be like the naysayers, or people that are gonna be against it, or people that don't believe in it. Just do it. Just do it. You don't know honestly where that's gonna get you. So just don't listen to what other people think about what you're doing. I think I've realized that growing up. I've been very different from others, honestly. So I used to, think something was truly wrong with me because my mind would just go in so many different directions, and I never really had a like, this is exactly what I'm going to be doing. No, because I would say this is what I'm doing, but then it would also be, but I want to do this and this and this, and my parents would just look at me like, you don't have a central direction. I told them I just can't, but I'm glad that I'm the way that I am, because it's allowed me to explore life in so many different ways, and then be a part of so many different things. But it also hones in on just one thing. Like, everything I'm doing is still a part of my purpose. It doesn't change. It doesn't deviate. So, and whatever sector I'm in, I'm still doing exactly what I'm supposed to be doing. And it encourages me, and it lets me learn and meet other people. So, just continue to just push yourself to be the type of person you want to be.
Love that a lot. And yes, I feel like a lot of people do put their limiting beliefs on us. And yes, it is tough in a society, but we have to say, like, we have to live our lives for ourselves, because you don't want to regret something because somebody else made you feel a way about it. Like, just do it for yourself.
Exactly.
So yeah, I completely agree with that. And is there anything else that I didn't ask around Coy Fish that you think would be interesting to share?
Just no. I mean, I look forward to seeing other people's remarks about it in the near future. But yeah, just being a lookout for Coy Fish in several months, years to come. So yeah.
Awesome. Well, we look forward to that. And then in that exact same vein, where would you like to see yourself in the future?
That's a good question. That's a good question. I don't know. I can't even say anymore. I don't know where my life is going. I was always the one that was like, oh, by this time this year I'd be this and be that. But because I never in my wildest dreams would ever think that my life would be in this way. So to answer your question, I don't know. It's at this point, it's wherever my purpose takes me, I'll go. So
That's a beautiful response, and like I appreciate that a lot, because I think a lot of people do, like, in that same effect, like, limit themselves to saying this or that, but we don't even know the extent to what can happen. Like, I'm guessing that you never imagined that you'd be starting a health tech app and stuff like that, but life and experiences take us to places that we never imagined. And like, as you said, like, walk in your purpose, walk in your passion, and it would be, and you will find what you have to do in whatever sector that is. So yeah, love that a lot. Okay, now moving on to the last section of the show, the Furious Five. Number one, what advice would you give to a student trying to pursue a career in public health?
I would say in public health is follow your heart, but then also be curious to learn more about things that you never really thought about. So public health, there's so many facets of public health. There's business in public health. There's law in public health. There's even engineering and public health. Like, you don't know, like, until you really see other people doing it. So I would say just don't limit yourself. Really be broad about learning more about what public health is all about, because you never know where it's going to take you.
Absolutely. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Don't listen to negativity, and don't listen to your mind telling you that you can't do it, because you can. So truly tell yourself that you can do it, because it'll happen when it needs to happen. So don't believe what your mind can say sometimes, because sometimes it can trick you into believing that there's something you can't do when you can do it.
Absolutely. Number 3, what's something you are working on improving in your life right now?
I'm working on my imposter syndrome. I feel like everyone has an imposter syndrome, when they feel like they are doing things, but they feel like they're not on the level to do so. But I'm realizing that I have something to contribute. And so if people are asking me to speak on panels, it's for a reason. I mean, so I'm learning to work more on believing truly in myself.
I love that. And number 4, professionally, do you recommend anything?
Professionally, I don't necessarily recommend anything, but I say connect with as many people as you can, even if you don't know them. Still link up with them. I use social media, not social media, LinkedIn specifically, a lot to connect with other people, even people I've never met, but in some way or another, there's another person that knows them that then eventually knows you, and then is able to make that connection with you for something that you never really think of. So definitely connect with as many people as you can in this world, because you never know what that connection is going to get you to.
Yeah, absolutely. And in the same vein, going back to Coy Fish for a bit, and I guess it's my podcast, so I can do whatever I want.
Yeah.
Have you had a lot of mentors or coaches around that? And tell me about
Yeah.
that experience.
Yeah, I've had mentors who already like that were in the entrepreneurial space to begin with. I remember one of the mentors that my other co-founder and I were talking to was somebody from Morehouse School of Medicine. She was an MD, the ND program, and she was also an entrepreneur too. So we thought we were both crazy doing this while we were in school, but it was good to see. It was refreshing to see someone that understood exactly what we were going through. There's times where like we would literally like be so frustrated together, and we talk to each other about our process. So that was helpful. But when you're building a company, you need mentors, especially people that have already been through it, because they're the ones that are going to push you to know that this could be done. Because you see they're getting funding, you see they're getting millions of dollars. So you see that this could be done. So you need mentors to help push you, and then tell you like you need to change this, or this is absurd, or they're gonna really challenge you. So you definitely need mentors in this space.
Yep. Okay. Well, thank you for sharing that. And then the last question: where can people connect with you?
Definitely connect with me on LinkedIn. I'm very friendly, like, so anyone that has a question, I can definitely try my best to answer it. And if I don't know the question or don't know the answer to it, then I can definitely reach out to somebody who might know it. So please reach out to me on LinkedIn.
Awesome. Well, Calbeth, I'll definitely put that LinkedIn link in the description and in the show notes for everyone to connect. But thank you so much for coming on and sharing your wealth of knowledge and your journey with us today.
Thank you.
Truly is my pleasure. So housekeeping items, everyone. Be sure to subscribe if you have not as yet. Leave a like if you're watching this on YouTube. If you're listening to this on a podcast platform, leave a 5-star review and share it with a friend. Greatly appreciate the support. See you all next week. Peace.